Hello everyone, I am Dr. Bharti Gohe, MPT Ortho, RNTU, Bhopal. Today we are talking about the clavicle, commonly known as the collarbone. It's an important bone that helps us move our shoulders. Let's start with an overview. The clavicle is a key bone in the human body, forming part of the shoulder girdle. It's an S-shaped bone that connects the sternum to the scapula, providing essential support and mobility to the upper limb. Introduction. The clavicle extends between the manubrium of the sternum and the acromion of the scapula. Anatomy of the clavicle. Now let's take a closer look at the anatomy. The clavicle is divided into medial and lateral ends. The medial end articulates with the sternum, forming the sternoclavicular joint, while the lateral end connects to the acromion of the scapula, creating the acromioclavicular joint. Side determination. Lateral end is flat and medial end is large and quadrilateral. Shaft is slightly curved so that it is convex forward in its medial 2/3 and concave forward in its lateral 1/3. Functions of the clavicle. Moving on to the functions of the clavicle, it plays a crucial role in shoulder movement, acting as a strut that keeps the shoulder joint away from the thoracic wall. This allows for a wide range of arm movement. Peculiarities of the clavicle: it is the only long bone that lies horizontally. It is the first bone to start ossifying. Sex determination. In female, the clavicle is shorter, lighter, thinner, smoother and less curved than in male. Attachments of the clavicle. At the lateral end, the margin of the articular surface of the acromioclavicular joint gives attachment to the joint capsule. At the medial end, the margin of the articular surface for the sternum gives attachment to, first, the fibrous capsule all around, second, the articular disc posterior-superiorly, third, the interclavicular ligament superiorly. Lateral 1/3 of the shaft. The anterior border gives origin to the deltoid. If you want to raise your arm sideways, the deltoids got your back laterally. The posterior border provides insertion to the trapezius. Moving outward, we have got the trapezius muscle. It connects to the back of your collarbone and helps you move your shoulder blades. Like when you shrug, think of it as the shoulder supporter. The conoid tubercle and trapezoid ridge give attachment to the conoid and trapezoid parts of the corticoclavicular ligament. They are like connectors. The conoid and trapezoid ligaments attach to the bottom part of your collarbone, acting like security guard, keeping everything snug and secure. Medial 2/3 of the shaft. The anterior surface gives attachment origin to the pectoralis major. The rough superior surface gives origin to the clavicle head of the sternocleidomastoid. The oval impression on the inferior surface at the medial end gives attachment to the costoclavicular ligament. The subclavian groove gives attachment insertion to the subclavius muscle. The margin of the groove give attachment to the clavipectoral fascia. Clavicle is commonly fractured by falling on the outstretched hand, indirect violence. The most common site of the fracture is the junction between the two curvatures of the bone, which is the weakest point. The lateral fragment is displaced downward by the weight of the limb. The clavicle may be congenitally absent or imperfectly developed in a disease called cleidocranial dysostosis. In this condition, the shoulder droops and can be approximated anteriorly in the front of the chest. Thank you for joining today's lecture on the clavicle. Stay curious and keep learning.